is, looking after our medics?
Thank you, Ashley. That's an important question.
Yeah.
The health system requires health professionals because even if we have, for example, every other input, without health professionals, it cannot function. Now, the health professionals work in a team. So we have many different professionals with different skills, and we need to ensure that we produce enough, because if we don't produce enough, then we'll never have the same. So that's where KMTC comes in.
Yeah.
We identify the skills needed, and we also ensure that we develop enough healthcare professionals for every part of the country. So at present, we have campuses across the country in at least 45 counties. We have about 84 campuses.
Yeah.
We train about 95 courses. So different skills to ensure that new health professionals are produced, but also those who are already health professionals can come and get additional skills so that we have quality healthcare. Because universal health coverage is about three things: access, which is increased by having an increased number of health professionals in every dispensary, however remote, near to the people. Number two is quality. So giving skill sets that ensure there is quality, and this is so dynamic, so we have to keep on getting, the skills updated. And then thirdly, to ensure people are not impoverished by seeking healthcare, so like ensuring that the health services are close to them. That is our contribution.
Okay, you've mentioned the fact that you have to ensure that there is enough.
Yes.
And we've been hearing doctors cry, saying there's a shortage when it comes to doctors in the country. What do you think could be attributing to this? Is it that we're not training enough?
Yes, we have a shortage of human resource for health across all cadres. And this is not only in Kenya, generally across the world. There are aspects of production, so we need to scale up production, produce more every year. So if we are graduating a certain number, we need to increase. And this is because the population is increasing. So, and people are living longer because of better healthcare and among other issues. So the need to increase has many reasons. Even the shortage has many reasons. There's also attrition that we must take care of. So increasingly, we have to train more. And KMTC, that's why we have many campuses. Like even this year, we've opened a few to help us increase the number of people that can get opportunities to train. We also increase the number of courses available, so that, for example, the specialist courses are also increased, so that we get more. So indeed, there is a shortage. The doctors is a shortage, clinical officers, all the other cadres, and we must look at all of them and really ensure that we produce enough. Then after producing, we have to ensure that they are able to work. Because if they are produced and can't work, that's another issue. And then we see the performance, we monitor the performance. We also have to, on the other side, ensure patients can access the healthcare facilities. Because if you have the health professionals, but the people cannot access, then again, it's an issue. So we must look at the supply side and demand side, and we must ensure that the health professionals are fit for purpose.
I'm just curious, then, what are some of the challenges you face while training these health professionals?
Oh, thank you. Yes. So first, we need what we need, the inputs that we need for training. We have infrastructure that we need. So that's why we are opening campuses, because the training has to be at a campus. That campus has to be adjacent to a hospital. So normally we want right next to the hospital to have a KMTC, because a lot of our training, actually 70%, is the skills, which they have to do the actual work.
It's
practical work.
Yes.
They have to, and most of it is in the hospital or a health facility that is adjacent. So we need at KMTs to have a campus with the infrastructure and equipment and technology, but also in the hospital. It has to have the capacity to run the programs. This could be bed capacity, this could be having the different departments, the equipment, this could be having the health professionals there. So in KMTC, we also need the health professionals who are now educators, need to be there. But in the hospital, we need to have mentors and so on. So the issue of infrastructure, it could be, besides the buildings, there's also like transport infrastructure. because you don't use one health facility, you use several, meaning you have to transport students to go there, and also the staff have to go and supervise them. So for us, the transport infrastructure like buses are really important. Now the ICT infrastructure and other technology, whether technical technology like instruments for doing specific skills or for learning, are also quite important. So we are using like simulation laboratories for training, and that is also quite intense in terms of technology. So laboratories of all sorts, computer, simulation, so on. Libraries are really important as well. So those are the main inputs that we give.
Yeah.
Teaching and learning resources of different types. We need that.
Okay.
We also go into the community, so we have to constantly engage with the community.
Yeah. And we'll be talking about community health workers and, training them shortly. But I just want us to continue with the fact that earlier on you said there is need for quality. And for the fact that there's need for quality, you need to keep on improving. What does it take for such an institution to keep on improving?
Okay, thank you. So first, it takes a realization about the changing needs, because our communities are changing in terms of the demographics, even the kind of diseases, it's also changing. So we must work very, very closely with communities, with health facilities, with county governments, with the national government, because we train for the needs of the country. And now we're also training for the needs of beyond the country, the region and the international arena. So keeping up to date on those needs is really important. Research is also very important aspect of that. Then having adequate staff who also have the skills required is really important. Those staff could be lecturers, but also could be people working in the hospital, could be laboratory people, technicians, and so on, because it's about the skill sets. Accreditation is really important. We have accreditation internationally and also nationally. It's with regulatory bodies. So there is a criteria that you use to identify. They come and check to ensure that we are giving quality services. We are also accredited by the Kenya National Qualifications Authority, which is really mandated to do that. Then we work with various stakeholders to ensure we are getting feedback. We also work with our alumni. When they go out, they are able to tell us, did what you train, what we trained you, did it help? Does it help you now? So we get a lot of feedback, and we are constantly reviewing our curricula and developing also new programs to ensure that they meet the needs of the country, and that the person we are producing is really fit for purpose.
There was a day we were joking that as long as you're a doctor or or a healthcare worker, just know you'll constantly be studying. Because you need to improve yourself. Does it ever stop?
Absolutely. One, we need continuous professional development. And it's a requirement for every health worker every year to show you have participated in this. If you do not do that, you would not be fit for purpose. So really what we can do, like at KMTC, is to make sure there is access to the kind of courses that are needed, such that now people have access. And those courses can be available in different forms. Some of them are online, some of them you come physically and you get to learn them. So a bit of flexibility to ensure people can access the courses.
Okay.
Yes.
One of the questions that so many people have been asking is, KMTC has been there for over 90 years, but there seems to be no degree programs. Why is that?
Well, KMTC, the mandate and the role of KMTC is to ensure we have a team with the right skill sets. And the skill, not every skill needs first as a degree. There are some, because even those who have degrees, we still have to keep on going for these courses. So the space that we feel, the area that we feel, is to make sure those skill sets are available. So although we're not offering degrees, people with degrees come for our programs as well.
Okay.
So we have, right now in our system, I'll confirm to you that we have people with bachelor's degree, master's degree, and even PhD, some people in our classrooms, because there is a course that they need to take to get a skill that they want. So the place that we feel is to make sure the skill sets in our healthcare team, are updated, they are available. Yes.
And what about parallel programs? Because even that is not available.
Okay, it's not available at the moment.
At the moment,
but
okay.
We are saying we keep on growing according to the needs. So what's happening? Parallel programs would be offered in the evenings and on Saturdays, for example. Although we don't have parallel, we still have some courses that are offered in the evenings. So for example, we have people who are coming to do NCLEX. NCLEX is the course required, let's say, by nurses who want to migrate to the US or Australia, the places, they have to do an examination, an international examination. For that, they need preparation. Now, that kind of course, we offer it on an evening basis. So we have some courses that we are offering flexibly. Now, the regular programs, we don't teach them in the evening, but that time they are engaged in additional activities, some of them in the community, some of them co-curricular, extracurricular, because those are also important. However, we also respond to demand. So we demand for evening courses. It's also something we are thinking about.
Okay.
And in the near future, we'll be able to offer some of them.
All right, let's now dive into community health workers training. Talk to us about the role KMTC plays in this.
Yes, so the community strategy is really important, and we are saying it's also delivered by teams. So even in the community health work, it still requires teams. So we have community health promoters, we have community health assistants, we have community health workers.
Yeah.
And they work together with the other teams. So if you have nutritionists, nurses, public health people are part of that. So what KMTC does, it trains community health assistants who essentially are the ones who offer support to the community health promoters. We also trained community health workers that also further supervise community health assistants and community health promoters. Then we train the other teams, like public health people, who also work within the team, because the community health promoter cannot work alone. So what we are doing is to ensure we make it possible for the teamwork. We make it possible that at the community and also at level 2 health facilities, because at level 2, where you have dispensaries, it is people trained in KMTC who are there. Also, if it's community diagnosis and home visits, they are also done by the people at level 1, the nutritionists, health promoters. So we would say we facilitate the team and all the skills that they need, and also them being able to work comfortably and understanding their different roles.
Okay. So then, from where you see it and looking at it, widely towards achieving this universal health coverage, what are some of those reforms that we need as a country to ensure we get to where we want to be? So
there are several things. If we look at the health system, yes, it needs health financing, for example, which is a big challenge, because many of our people, when they have to pay for health service, at the point of receiving the health service, they may not have the money.
Yeah.
So we need to, perhaps through the tax system, ensure that you're not having to be asked to pay at the time of receiving the service. So health financing, important issue. Number 2, the health workforce. So the production, we need to scale up production. We need to continuously identify whether they are fit for purpose. So identifying if I'm training this particular course, is it fit for purpose? Is it cost effective? What is the impact of people in that particular course? So that requires us also investing in data, health information system, so that you're able to look at the dashboard and say, oh, I can see this is the impact or this is the input required. Investing in research, again, is really important. Research about health services. Often we do a lot of research about maybe diseases, which is also important, but we must also look at research about training and health services, really important. Service delivery, again, once we are in the hospital, what is the waiting time, for example?
Yeah.
Who is being served? Because if we don't look at that data, we might find that the people we are serving are mainly people nearest to the health facility, or they're mainly people of a given age group. There could be people who are left behind, and yet UHC, we do not wish for people to be left behind. We could ask, are widows being left behind? Are children, with disabilities being left behind? So the health information system can absolutely help us that. Leadership and governance. So we need leadership from, within the health facility. We need leadership within the community. We need leadership at all levels. And because the needs keep on changing, the leadership styles also, need to keep on changing. So even capacity building for everyone, even as we are training them with leadership, which is something that we focus on also at KMTC, make sure we train with leadership.
Okay.